reader. Thank you so much for your overwhelming response on my previous video about breastfeeding, and I'm so happy to know that so many of you are now motivated to breastfeed their child. So today I'm going to take that topic a little bit further and talk about infant nutrition. That is what and how and when you should introduce solid foods to your baby apart from breastfeeding. And this is known as complementary feeding. So before I begin today's topic, I think you should all understand the concept of 1000-day nutrition. So when a baby is conceived in the mother's uterus, to the day when the baby attains 2 years of age, roughly constitutes to about 1000 days of his or her life, and this is the time when maximum amount of growth occurs, both physically as well as intellectually. And nutrition plays a very, very important role in this growth phase. So because we all know that for a seed to become a plant and then a tree, you need to take utmost care, and nutrition, of course, water, sunlight, manure, plays a important role. So similarly, nutrition is very important in a child's growth also. And so many studies have been conducted, and they've proven that children who have a better nutrition in these first 1000 days of their life, they go on to become healthier adults, 10 times healthier in fact. They score better grades than the other counterparts, and eventually they nurture healthier families. So with this basic concept, let me begin today's topic about complementary feeding. So whenever you start complementary feedings, there are certain things you need to keep in mind. That the food should be always freshly and hygienically prepared. It should be safe and easy to digest. It should be available at home, and should be of the right consistency, that is not too thick or too thin, and it should be culturally acceptable at the home also. Now let's begin with the first aspect of complementary feeding, that is when to start complementary feeding. Now in the 1000-day nutrition concept, the first 9 months in utero, the baby is solely dependent upon the mother's nutrition. The first 6 months after life, it's as we've seen in the previous video, breastfeeding is the ideal food. And now after 6 months is the time when you should introduce solid foods along with continuing breastfeeding, and hence it is known as complementary feeding. So most of you may ask the next question, that why 6 months, why not earlier or why not later? Well, as you can see in this pic on the screen, that by 6 months now the baby's head is held steady. It will not fall off. The baby can sit without support for a few minutes, and with support, of course, it can sit for a long time. Also, the hand to mouth reflex is now mature. That is, if you place something in the fist of the baby will take it straight to the mouth. If you give something by the spoon, baby will lick it off and not spit or push it off, because the swallowing reflex has also matured. So these are the signs which tell you that now your baby is ready for introduction of solid foods, and hence 6 months is the ideal time to start the complementary feed. Now we've seen when to start the feeds. Now let's see how to go about it. So traditionally, we were informed by our ancestors, and even pediatricians used to advise that by 5-6 months you start something which is liquidy, that is dal ka pani and chawal ka pani and all that. But I think over the years, studies conducted has shown that that stage could be altogether skipped, and now we have what we known as 3 stages of complementary feeding. So the first stage is the puree stage, which is from 6 to 9 months. The second is a little bit lumpier than that, from 9 to 12 months, and after 12 months it is a soft and mashed form. And in fact, by 1 year your baby can be fed from the family pot feeding, that is whatever you make can be given to your baby as well. So let's see the examples of how you can go about the 3 stages. So the first stage, that is puree stage, is where you can introduce vegetable purees and fruit purees, like say apple or pear, and vegetables like spinach and pumpkin or cauliflower. Be very certain about one thing, that whatever you prepare should be freshly and hygienically prepared. So absolutely no to tinned foods or packaged foods, and do not add extra sugar onto it. Let the natural taste be there in the food so that the baby can develop the taste. Salt is a little debatable because ideally it's not needed, but if you feel that your baby it's very bland or something which you baby cannot have at all, you can have you can add a little bit, just to make it palatable. I would suggest that whatever food you introduce, let it the child get accustomed to it for about say 2 to 3 days, and then introduce another food. So for example, if you're starting with vegetable purees, say for a spinach puree, and after 3-4 days introduce the pumpkin puree, and like that, when 2 to 3 weeks are gone, you can move on to the fruit purees. So this way the baby will develop the taste for each food differently. Now when it comes to the 9 to 12 months, you can give a little bit of lumpier foods. That is, for example, you can give a mashed potato or mashed bananas, and the simple difference being that in the first stage you need to use a mixer, and in the second stage you can hand blend it. So in fact, from 10 months onwards, 9 to 10 months, you can actually start finger foods, because now the baby can sit completely without support, and his or her hands are free, and the pincer grasp, that is the grasp between the thumb and the first finger, is well developed. So if you give something to the baby will put in the mouth and start eating. So for example, steamed carrots or steamed potatoes you can give, and the baby will enjoy it. And by 1 year, of course, you can give family pot feeding, as I already mentioned. That is, you don't need to use a mixie or a hand blender. Also, just mash it softly with a spoon, and you can give it to the baby. For example, khichdi or dal chawal, or roti immersed in dal, and vegetables which are boiled and mashed with a little bit of gravy inside. You can give whatever you are eating, you can give the baby as well. Now let me shed some light about baby-led weaning also, which is very popular in the Western world and is gaining popularity here too, especially amongst the nuclear families. Literally it means that the baby helps you in the process of weaning. So by the age of 6-7 months, when you introduce solid foods, you place the baby on a high chair and let the baby eat on its own. So need not go by the stages of puree and then lumpier and then mashed foods. In fact, you can give all together and let the baby explore and eat on their own. So for example, you can give a little bit of yogurt in a spoon, or a small piece of mashed potato or banana, or that way combination of foods, and let the baby eat on their own. Now the pros and cons of this are that it can be a little messy, and actually there's a lot of wastage, that babies waste a lot rather than eating, because their coordination of hand and mouth is not that much mature, and their swallowing is also not mature, so they spit out and they make a mess of everything. But the advantages are that they learn to understand the food by its smell, look and texture, and in fact they become less picky eaters later on, and it makes the transition very smooth. So there's a lot of debate about whether you have to go by baby-led weaning or by the stage of feeding. I would say that you can always use a combination of both. Though there are not many studies which say that the combination works better, but I think it's a practical approach, wherein 1 or 2 meals you can give your baby on your own, that is, you feed the baby, and 1 or 2 meals the baby can eat on their own. So this way you make sure that the baby starts to explore eating on their own also, and simultaneously they don't miss out on the there's less wastage, and they don't miss out on the nutrition and calorie aspect also. Now let's move on to the third aspect of complementary feeding, that is how much to give, because we can be a little bit over enthusiastic in feeding our children. So it's very important to know how much to give and how many times to give. So a rough guide is that at 6 to 9 months the per serving amount should be around 150 ml. From 9 to 12 months it should be around 200 ml, and from 12 months onward it should be about 250 ml. And from 6 to 9 months you can give 3 meals per day. From 9 to 12 months it's 3 meals and 1 or 2 snacks per day. And from 12 months onwards it should be 3 meals proper and 2 snacks. Well, this is in accordance with breastfeeding. So if you're still breastfeeding, this is the schedule that you should follow. But in case you have stopped breastfeeding for any reasons, you can increase the amount of servings, like 1 or 2 servings, and also make sure that your child has at least 1 to 2 cups of milk per day. Again, the guide that I have given is a rough guide, and it does not apply to each and every child, because each and every child has their own capacity of eating. So you should not force feed. And I could give a tip that whatever your baby's weight is, the stomach capacity is roughly 30 ml per kg of that weight. So for example, if your baby's weight is say 8 kg, so 8 into 30 is 240 ml, and of course the entire amount cannot be filled with the food. You have to keep some space for water and air. So the rough amount would be around 180 to 200 ml. So if you follow this, I think you won't underfeed or overfeed your child. Let's move on to the fourth aspect of complementary feeding, that is what all to give. So as you know that variety is the spice of life, we also don't like the same monotonous food. Similarly, you need to introduce all various type of food groups into your child's platter. Why? Because each each food product has its own importance in the nutrient chain. And also, if you introduce a lot of variety into your child's platter, the child's taste buds develop accordingly, and the less picky of an eater he or she will become later on. So as you can see the food pyramid, that the major source of our food consists from the cereals and pulses. A little less comes of serving should be from vegetables and fruits. A third is the poultry and the dairy products, and the least should come from the fats and the oils. Now if you include all these food groups, you will be making sure that none of the nutrient is missed on, that is carbohydrate, protein, fats, and vitamins and minerals. Also another good way to include all the food groups is, if you remember, the rainbow food color into your food's plate. So as you can see in the pic, that the red represents the fruit group, the green is the vegetable group, the purple is the poultry and the protein group, or the legumes or pulses, and the brown represents the cereals, that is the rice, wheat and everything, and the white is of the dairy products. So if you're including all these things, you're not missing out on the nutrients, plus you're making the food look very attractive and enticing to the baby, to make it more encouraging the baby to eat more. Also, you could try different food arts for a baby, so that the plate looks attractive and the baby will eat. Please make sure that you include a lot of fiber-rich food like oats, and you give the fruits. If you're give it with the peel on as much as possible, because this aids in the digestion, and there are less chances of constipation also if you give these fiber-rich foods. So now moving on to the fifth aspect of the complementary feeding, and I in fact feel it's the most neglected one also, and I would like to name it as the mealtime ethics, is that whenever you're feeding your baby, please make sure that there's a designated place for where you feed the baby. And like for example, if there's a dining table, or even if you have a kids room designated, you can make a small corner and feed the baby in the same place. What will happen is that the baby will be conditioned to eat at the time, and also there will be a sort of discipline which is followed. Secondly, there should be no screens or tablets or phones on when you're making your child eat, and absolutely no bribing. That you'll keep the child's favorite rhyme, and if the child eats, and all sorts of things. One more important aspect is that whoever's feeding the baby, whether it's the mother, father, grandparent, or any caregiver in your family, make sure that you talk with your baby, have a lot of eye contact, and you can actually say stories, because you need to make the mealtime a very pleasurable time for the baby. And because it's human nature, if something which is very pleasant has a tendency to be repeated, and something which is unpleasant, you do not want to do it again. So if you make the mealtime very enjoyable for the baby, the less tantrums the baby will throw. So this brings us to the end of our discussion on complementary feeding or infant nutrition. And the take-home message would be to start complementary feeding at the right time, that is 6 months. Go stage by stage, know how much to give your child, include a lot of variety of food in your child's platter, and also let them explore the food on their own as they grow a little bit older. And make meal times a very pleasant and enjoyable time for them. And something which I missed out earlier to mention is that whenever your baby is sick during this time, do not force feed your child, but also make sure that the child is having the minimum amount of calories required. And once the child recovers from the sickness, you can increase 1 or 2 servings and make sure that the lost calories is regained. So I think I've covered all the points, but if you still have any queries, please feel free to ask, and you can give any positive or negative comments also. And people living in Delhi or Noida can also come visit my clinic for any sort of consultation or advice on nutrition. I'll be back soon again with another interesting video. Till then, take care and stay safe.